Welcome to Aches and Gains, a weekly talk show covering all aspects of pain and pain relief. I'm Dr. Paul Christo, pain specialist at the Johns Hopkins University School of Medicine. Pain has reached epidemic proportions, and chronic pain affects a staggering 25% or more of the population. Its human impact is real and is felt by infants, children, all the way to older adulthood. But there's hope and there's treatment. This show offers compelling stories of those who found relief and offers insight into treatments that can ease pain and human suffering. Musculoskeletal pain affects the bones, joints, cartilage, muscles, ligaments, and tendons of the body. Often, overuse, repetitive strain, or trauma results in tenderness, muscle spasms, and even weakness. Musculoskeletal pain is among the most common reasons for seeing a doctor and affects about 30% of adults. Treating musculoskeletal pain can be tough, but our first guest, Pete Egoscue, has developed a unique method of providing an exercise therapy program that focuses on posture realignment. We'll learn about his techniques and then hear from Rod Sussman, a professional tennis player and longtime client of the Egoscue method.
Aches and Gains is sponsored by King Pharmaceuticals, Endo Pharmaceuticals, Neurogesics, and Boston Scientific. Aches and Gains is also available live online. Follow us on Twitter at Dr. Paul Christo and like us on Facebook, Aches and Gains. To access podcasts of the show, please go to paulchristomd.com. That's paulchristomd.com. If you have questions or comments for Dr. Christo, especially for upcoming shows, please email him at achesandgains@gmail.com. That's achesandgains@gmail.com.
The posture guy, Pete Egoscue, has been an anatomical physiologist since 1978. His exercise therapy program focuses on treating chronic musculoskeletal pain due to workplace and sports injuries, accidents, aging, and other conditions. Pete's been a consultant to some of the biggest names in sports, including Jack Nicklaus. He's established 24 clinics internationally and has authored 4 books, including the one we'll discuss today, called Pain-Free Living. Pete, welcome to Aches and Gains.
Well, thank you, Doc.
Pete, it sounds like you've been out of the country. Tell us what you've been focusing on and how your clinics have been doing.
We're very blessed in that in our 20-some clinics, which is just, as you know, a small part of our business model, but we had a record year, and so we're very blessed and fortunate.
That's fantastic. In the introduction to your book, Pain-Free Living, you talk about a Buddhist quote, "Pain is inevitable, suffering is optional." After reading your book, I'm wondering whether you would want to change that to pain is optional, not inevitable.
No, I think that the design of the human body is so magnificent and so complete that because of its capabilities, inevitably, if you use it to its capabilities, we're going to suffer occasional aches and pains just as the nature of our achievements physically. But to be afraid of those, the reason I use that quote, Doc, is to be afraid of those aches and pains leads to suffering, which in my view is the presence of fear, and I don't believe that's should be part of the lexicon of healing.
So, Pete, tell us about your life's work, the Egoscue method.
It was actually thrust upon me, more or less as an accident of me being a Marine infantry officer, and then the process of rehabilitating, and then myself, and then Marines coming and starting to ask me questions about their own aches and pains, and I became fascinated by the human body, and it became a hobby, helping others, and then that gradually grew into what we know as the Egoscue method today. And what the method is nothing more than an acknowledgement of the singleness of design of the human species, and a series of personalized approaches, physical approaches, to restore the musculoskeletal neurological frame to its design position.
Do you suffer from persistent pain yourself?
I do not now, and I did. Yes, I did. I had neurological referral and musculoskeletal difficulties in my left hip, resulting from being wounded in Vietnam, and that's what started the whole thing. And here we are.
Okay. Pete, how do you help people reframe the feeling that I often hear from patients that pain is the enemy?
A great question. We ask the patient to do a what if, and the what if goes like this. All right, I understand that in your history coming down through before you got to us, that it has been isolated to and proven to you that you have fill in the blank, herniated disc, torn cartilages, arthritis, et cetera, et cetera, et cetera. What if those maladies are the result of the body being designed to rupture the disc or tear the cartilage? And two, what if it's the body trying to tell you something? And the patient then says, well, okay, then I should be able to learn what it is the body's trying to tell me. And then we just proceed into the evaluation process from that position.
It sounds like then it's sort of a postural imbalance.
In my worldview, the body is telling you that you're off balance. The return to balance is what I believe to be, regardless of the condition, the key to the success of a pain-free life.
I'm wondering how your method, the Egoscue method, is different from physical therapy or yoga.
There's nothing new under the sun. The disease model says that you trace the pain to its source and treat what you find. By necessity, then, the physical therapy treatments are centered on the pain site, and they're centered on mitigation of the symptom. We don't do that. We're not physical therapists, and we're not trained in the modalities of site treatment. We're postural people, and we back up and treat the body as a unit.
And speaking of the body, your book encourages patients to move that part of the body that's painful. And indeed, there's emerging evidence that doing what the body would do naturally may indeed redevelop neural connections and ease pain.
You've stepped right on the cornerstone of the method, and that is there's nothing to fear. I don't believe that the avoidance of pain is wellness. I believe that the absence of limitation is wellness. We want our clients to raise their sights, in effect, from just getting rid of the pain to a return to an active lifestyle.
Yes, we're both trying to reduce pain and improve function. When we come back, we'll talk to Pete about how his method improves energy, activity levels, and mood. I'm Dr. Paul Christo, and you're listening to Aches and Gains.
Follow us on Twitter at Dr. Paul Christo and like us on Facebook, Aches and Gains. Aches and Gains is sponsored by King Pharmaceuticals, a leading pharmaceutical company focused in specialty-driven markets, including pain management, and dedicated to improving and protecting quality of life for people around the world. If you have questions or comments for Dr. Christo, especially for upcoming shows, please email him at achesandgains@gmail.com. That's achesandgains@gmail.com.
Welcome back. Pete, tell us why your clients report improved energy, activity levels, and mood.
As the generator, meaning the human form, as that generator comes back to balance, it begins to generate what you and I call metabolic rate, meaning the furnace heats up. Several things happen. The well-being of the patient increases, not just because there's no pain, but because their feeling of inadequacies and limitations in their world begin to diminish. Trick is to get them to understand that that's happening not because the pain's gone away, but because they're now living a balanced generator, musculoskeletal, neurological lifestyle.
Take us now through an actual Egoscue clinic visit.
We listen to the patient, establish a connection based upon their first visit, which is the patient narrating their symptoms and their journey. Then there's a postural evaluation process. It's pretty high tech, and we compare the patient as they present to the design template, which is the constant. Then there's a series of exercises that are prepared, personalized to that individual and their what we call their compensations. Therapist takes them through the process, explaining what's going on, and at the end of that visit, then the patient is encouraged to decide if they're in the right place. If they're in the right place, they've concluded that because they feel better. They're less fearful because they understand the nature of why they're in so much pain and why they haven't been able to get better. And then they're set up with a series of appointments, and those appointments are a reevaluation process each time they present, new program presented because the body's changed, so it requires new stimulus. And the objective, set day one is for the patient to be able to return themselves to their designed balance position.
That sounds pretty complete. Tell us, what is the length per session, the cost, whether it's covered by insurance, and how many sessions are required?
8. We have the luxury of spending in excess of an hour with each one. $1,495 for 8 visits is usually what people decide to do. As we tell the patients, you make up your mind your first visit, and if we're not your cup of tea because this is out of pocket, you should kick us to the curb. You don't invest in something that you're not invested in yourself.
Pete, I'm intrigued by your mantra, which is a cure, not just treatment, especially for patients with chronic pain. How do you know that you cure your clients?
Anecdotally, you've stepped into an arena where my critics are in effect. They have a very valid point, and that is, well, where is your scientific evidence that there is a cure? In other words, where's your research? We have multiple organizations researching us, but I believe that a patient who comes to me and says, I'm back, fill in the blank, doing what golf, tennis, climbing, hiking, running, whatever, and I have no pain, is proof that, in effect, they are free of pain and they're therefore cured of the causal factors.
It's encouraging to hear that your methods are being studied. The premise of your book is that improper posture makes us vulnerable to pain, especially musculoskeletal pain. What's happening to our bones and muscles when our posture is imbalanced?
Muscles are compensating as we lose our balance. Bones are losing density. We're becoming unstable, imbalanced, and unable to generate the energy necessary for a high metabolism.
Do you feel that your method can be used in place of medicines, joint or disc replacements?
Well, it happens every day.
Wow, that's good to know because I have a lot of patients that I can send to you. Pete, give us an idea of what kind of musculoskeletal pain you can treat the best. That is back pain, neck pain, pelvic pain.
Body's a unit, Doc. We treat it as a unit. So we see everything from migraine headaches to plantar fasciitis, and you name it, we see it. Do we fix everybody that comes to us? No, of course not. The people we're incapable of helping can't overcome their own belief structure that says they're damaged, they're hurt, and there's nothing that can be done.
Pete, Jack Nicklaus provides a powerful testimonial for your book. Can you share with us what you did for him?
All we did was point out to him that his compensations, his postural compensations, were the reason that not only were the discs herniated, but that he was having all this pain, and he proved it to himself, and away we went.
It sounds like you helped Jack quite a bit. So tell us, when would you refer somebody to a pain specialist or to a surgeon?
Our basic assumption, the changes of your posture are not mitigating your symptom, are they? No. Okay. It's time for you to seek someone outside of us.
Well, that seems reasonable. And Pete, before we close, will you provide us with the most important recommendation for a balanced, pain-free posture?
Stay barefooted as much as you can. Pay attention to your habitual activities and modify them just gently. For instance, if you run and you run the same course every day, change your course. If you walk, change the time, change the pace. If you sit in a chair, change your chair. But above all else, please don't go to war with your body. Don't assume that pain is the enemy. Listen to your body and trust self. If you'll do those things, you're in good shape.
That sounds like good advice. Pete Egoscue, I want to thank you very much for joining us today.
Doc, thanks a lot. I enjoyed it.
When we continue, we'll hear from Rod Sussman, a professional tennis player who's a longtime client of the Egoscue method. I'm Dr. Paul Christo, and you're listening to Aches and Gains.
Aches and Gains is sponsored by Neurogesics, a biopharmaceutical company focused on developing and commercializing novel pain management therapies. Aches and Gains is also available live online. Follow us on Twitter at Dr. Paul Christo and like us on Facebook, Aches and Gains.
Rod Sussman is a retired professional tennis player with a 13-year history of hip arthritis and muscle pain. He's a longtime client of the Egoscue method. Rod, welcome to Aches and Gains.
Thank you.
What kind of pain did you have that brought you to Pete Egoscue's clinic?
I began to have a right hip pain issue, so short of a long story, I went to 3 orthopedists trying to get one that would agree with me, and neither did. And they all suggested hip replacement, and this is 13 and a half years ago. So I knew of Pete. I figured I didn't have anything to lose but time and money, and so I went to him kind of skeptical, to say the least. He assured me that I would have improvement little by little, which 8 or 9 months later, I was virtually pretty well pain-free.
That's great news. Rod, tell us, in speaking to Pete earlier, it sounds like 8 sessions are required for his therapeutic program. Did you find benefit from all 8 sessions?
I went through 16 sessions. I was doing so well that I re-upped for another 8. And ever since then, every X number of months, he likes to see tenured clients get a refresher menu, as he calls them, which I do from time to time.
What exactly is done during the session?
The first thing they do is they take pictures of you, digital pictures of you, in a straight doorway with a plumb line to show you where your misalignments are. And from that, then they assess a program.
Rod, tell us, does most of the benefit result from the 8 sessions, or is it the work that you need to do after the sessions at home that's the most beneficial?
In my case, and again, with your medical background, you'd know better than I, but the hip being the largest joint we have, to reposition the femur, A, it doesn't happen overnight, and B, it's a lifelong commitment.
It sounds like Pete's method really produces a positive life change. How long did the realignment process take to the extent that you were pain-free?
He told me I'd ideally start to feel subtle relief on day-to-day tasks, for example, getting in and out of a car or climbing a step. And it would be just automatic, and you wouldn't think much about it. So that said, chronologically, I would say in the 7th month, maybe the 8th max, I began to notice day-to-day routines that were, quote, pain-free.
Okay, it's not an overnight process and really requires time and dedication to achieve lasting results. Rod, what makes the Egoscue method special?
I think what makes it special is that Egoscue tends to treat the entire musculoskeletal system, in a sense, even though you're in there for a specific complaint.
Well, Rod, when you were going through therapy with Pete, were you encouraged to move through your pain, or the reverse of that, stop participating in certain activities?
In my particular case, he took every form of activity away from me except walking. I didn't hit a tennis ball for 6 months. I didn't do any running. He took away my free weight program. He just took away the jar stuff. But that was me. I can't speak for the others.
Pete cites that his method produces more energy and soaring activity levels for his clients. Did you find this to be true?
Oh, definitely.
That's good to hear. What has the postural realignment process done for you? In other words, do you feel that you're less vulnerable to pain, especially musculoskeletal pain?
Yes. For example, I was subject to back spasm pre-Egoscue. Those have subsided greatly, almost totally. I believe the Egoscue method and its concepts, once we get our joints aligned, you should be less prone to injury.
And Rod, when would you recommend that a person actually go to one of Pete's clinics?
When they have pain chronic enough or serious enough to impair their normal lifestyle enjoyment. You know, I think anyone should be seeing physicians like yourself when their life is impaired by pain.
I agree very much. I feel that patients would benefit even more if they saw pain specialists earlier rather than later in their disease process. Rod, tell us, do you feel that Pete's method can be used in place of medicines, joint, or even disc replacements?
Yeah, yes, I do. And because I'm proof of the pudding, I think traditional medicine is beginning to see the benefit of realignment as an additional complement to possibly other traditional means.
Indeed, I'm aware that the Scripps Institute in San Diego has been working on the non-invasive means of musculoskeletal realignment and how that may very well act as a complement to other therapies. Rod, will you Describe how impaired you were before seeking the treatments of Pete Egoscue.
Well, it had gotten so bad for me that I had difficulty walking at all without reasonable discomfort. As far as playing tennis, that was out of the question. I came to him, as I said earlier, doctor, as a last resort, because I have to admit I'm probably one of his more skeptical patients. So I really didn't know what to expect.
And before we close, Rod, were you surprised at the difference that the Egoscue method made in your life?
Well, it made me functional, and I'm a very active person, and I couldn't see, 72, and this was in my, late 50s, mid to late 50s. I couldn't see myself becoming sedentary or dependent on ongoing lifelong medication. I also couldn't see the surgical avenue of response unless that was a last resort.
So despite your initial skepticism, Rod, it seems like Pete's method has given you a much more enjoyable life. Rod, I'd like to thank you very much for joining us today on Aches and Gains.
Thank you, and thanks for your time.
Aches and Gains is also available live online. Follow us on Twitter at Dr. Paul Christo and like us on Facebook, Aches and Gains. To access podcasts of the show, please go to paulchristomd.com. That's paulchristomd.com. Aches and Gains is sponsored by Endo Pharmaceuticals, a U.S.-based specialty healthcare solutions company that delivers innovative diagnostics, drugs, devices, and clinical data to meet the needs of patients in areas such as pain, urology, oncology, and endocrinology. If you have questions or comments for Dr. Christo, especially for upcoming shows, please email him at achesandgains@gmail.com. That's achesandgains@gmail.com.
Welcome back, and here we have a question from Sylvia in Harrisburg, Pennsylvania. Several months ago, I was experiencing pain on the inside of my right leg, above the knee, and also below the groin. It was particularly troublesome when driving for more than an hour. My doctor thought it was sciatica and sent me to physical therapy. The therapist thought it was the hamstring muscles. How do you know if the pain is from the hamstring or the sciatica? Well, Sylvia, if one of the lower discs is causing sciatica, a good history and physical exam can detect it in over 80% of cases. Your symptoms would be atypical for sciatica, though. A normal MRI or nerve tests that demonstrated no abnormality would also suggest a non-spinal source of pain. Sometimes the best way to tell is by your response to treatment. For example, hamstring exercises would probably not be very effective in relieving true sciatica, whereas treatment such as an epidural steroid injection would not do much to relieve muscle pain. It sounds like your physical therapist made the right call, but most cases of uncomplicated sciatica will also resolve naturally, so we may never really know for sure. Here's a question from Julianne in Tacoma, Washington. I was diagnosed with breast cancer in 2010, and the tumor was removed from the left breast with modified radical mastectomy. I was treated with chemotherapy and currently suffer debilitating pain, nerve pain in both feet, left hand, chest, shoulder, and weakness in the left arm. I'm taking oxycodone and amitriptyline at night. Any other ideas? Julianne, the neuropathic pain may result from the chemotherapy. You may consider increasing the dose of amitriptyline. The usual dosing schedule is either 10 milligrams at night or 25 milligrams at night to start, and then increases to a maximum of 150 milligrams. Other helpful medicines are the anticonvulsants, like gabapentin or pregabalin. If the oxycodone makes the pain tolerable, I would also consider extended-release oxycodone twice daily. Women who have mastectomies can suffer from specific nerve pain in the armpit and chest wall from irritation or surgical disruption of the intercostal brachial nerve, and this can be blocked with local anesthetic and some steroid.
The views and opinions expressed in this radio program are solely the views of Dr. Paul Christo and do not necessarily express the views of this radio station and Johns Hopkins University School of Medicine, nor an endorsement by any or all of them of any of its content. This show provides medical information, not advice. Please consult your personal physician before engaging in any course of treatment or use of any of the techniques or products discussed on this show. Discussion of particular uses of products on this show have not been approved by any of the manufacturers of such products. Aches and Gains is also available live online. Follow us on Twitter at Dr. Paul Christo and like us on Facebook, Aches and Gains. To access podcasts of the show, please go to paulchristomd.com. That's paulchristomd.com. Aches and Gains is produced by Eric Vore and Dr. Paul Christo. Ty Ford is the audio engineer, and Elsa Langford is the technical consultant and engineer. Thanks for listening. This is Aches and Gains with Dr. Paul Christo.